Hello, and welcome to our second episode of Franklin Forward FAQ, a video series answering questions from Franklin County residents about COVID-19 and how your family can safely navigate these unprecedented times. I'm Dr. Linda Thomas-Worthy, your host. We will hear from local leaders providing answers to your questions based on guidelines and recommendations from reliable sources. Joining me today are Dr. Michael Colli, Chief Medical Director and Director of Pediatrics at Keystone Health, and Commissioner Dave Keller. Hello to you both.
Hi, Dr. Thomas-Worthy.
Hi, Doctor.
Good evening. Our first question for today is from Mary in Greencastle. What would happen if our positive COVID cases numbers increase drastically? Will we be shut down again? A very good question, one I'm sure many are concerned about. Commissioner, could you answer Mary's question, please?
Well, sure. The short and direct answer is yes. If our active case numbers rise too high, we could once again be placed under a stay-at-home order in the interest of public health and safety. I think I can safely say, and most people would agree, this is an outcome none of us want. So then the question becomes, how can we prevent another shutdown from happening? The answer is we should all be actively following the CDC and Pennsylvania Department of Health guidelines for aggressive mitigation under the phase. This includes maintaining 6 feet of physical distance from others living in our household, washing our hands regularly, using hand sanitizer when hand washing isn't available, also to limit touching our face. And yes, this also includes the state mandate of masks anytime we're in public. I think Dr. Colli was spot on in his previous Franklin Forward FAQ video when he explained how the mask protects our community and prevents spread of the virus. The mandate requires mask wearing anytime we're in public indoors. It also requires face covering when we're in public outdoors and unable to keep the 6 feet social distancing. Aside from the people who fall under exceptions to the face covering requirement outlined by the Pennsylvania Department of Health, there is no risk or harm to us in wearing a mask. So we need to trust the expert scientists and doctors who've studied this and their findings that universal mask wearing can significantly decrease spread of the virus. Wearing masks everywhere in public will prevent us from needing to shut down again.
Thank you, Commissioner Keller. I appreciate your direct and informed response. I know mask wearing has become a divisive issue, but I see that it really comes down to wearing a mask to benefit the whole community, not just speaking of myself or the discomfort of wearing a mask. Our next question is from an anonymous Waynesboro community member. When can I feel comfortable having extended family or friends visit my home? Dr. Colli, what advice do you have to answer this question?
Well, thank you for that excellent question. And also thank you for allowing me to have the opportunity to be part of this series. I think this is very important. So I would start off by answering that question by saying that any encounter with anyone outside of one's immediate family can certainly increase the risk of exposure and contracting the disease. We are still a long way from a return to complete normalcy. The lessons we've learned from the resurgence of case counts in the southern states and in the Sun Belt are that the virus is still very much around, still very contagious, and really still quite dangerous. The more complacent we become and ignore the measures that have allowed us to flatten the curve here in Pennsylvania, the more likely we will be to have an increase in our own case counts. So I have a couple of rules of thumb that I have enacted in my own family to determining who we allow to come visit. First of all, outside is better than inside. So meeting people in an outside environment is going to be better from a viral transmission standpoint than meeting them inside. The virus just doesn't transmit as well when you're outside. Secondly, small groups are better than large groups. The fewer people you are with, the less likely the virus will be transmitted to a greater number of people. And third, physical distancing and masking are still very important ways to mitigate the spread. So if you have to visit with people that are outside your immediate family, I would recommend meeting them outside and in small group and keep your 6-foot distance, and everybody should wear a mask. I also endorse the concept of what I call a social bubble. That's where you allow only a small number of outsiders into the bubble of people that you are comfortably being around. So this might include a few extended relatives, a close friend or two, but the important thing is that you are controlling who they are, and you know that everyone in the bubble, in your bubble, shares the same COVID value system that you do. This means that those people that you're letting in that bubble are refraining from risky behaviors that could make COVID-19 more likely. They're limiting their social interactions with others outside of your bubble. They're refraining from large gatherings, and they're limiting unnecessary travel. I think we've all recently seen some social media posts of people throwing caution to the wind and resuming parties and get-togethers where exposures and COVID transmissions are more likely to occur. These are the people, in my opinion, who I would keep out of my bubble and exclude them from entering because their value systems are different than my own. So when will we return to a sense of normalcy? When herd immunity develops and transmission risk is minimized. Herd immunity is when enough people have developed antibodies to COVID and they are no longer susceptible to contracting the virus. Then the virus begins to die out. That is unlikely to occur until we have an effective vaccine that is created and becomes widely available.
Thank you, Dr. Colli. I love the social bubble concept. And there, again, we still have to remember to wear a mask and continue to socially distance ourselves. Before we wrap up, is there any final message either of you would like to leave our viewers regarding health and safety for our community?
Sure. I'd like to make a couple final comments. One is that COVID-19 is still here, and it's not going anywhere anytime soon. It's still just as contagious and dangerous as it was before. I think we're all getting a sense of COVID fatigue, and we're ready for our lives to return to a sense of normalcy. But we need to remain vigilant and do our part to mitigate the spread. If we become complacent and let our guard down, we will see case spikes. That is unquestioned. This will be over soon enough. Let's not compromise that future.
And Dr. Thomas Worthy, I would just dovetail on that and say, we need to continue to wear our masks and social distance. And whenever we maybe we don't want to do that, we just need to remember the folks who I think this whole situation has impacted the most. Obviously, the most vulnerable members of our community, those who've died from it, those in nursing homes or with pre-existing conditions who are especially susceptible, and who this is really hitting hard. We need to keep folks in mind. The healthcare workers, I don't think anyone signed up for this when they became a healthcare worker. I tip my hat to how they continued doing their jobs day after day in the face of this, because going above and beyond the call. So we need to keep them in mind. Small business owners, the sooner we can get past this, the sooner they can get back to their lives, putting people to work and supporting their families. And lastly, it's the kids. I mean, the children in our community, their lives have been impacted forever. They will always remember the trauma of going through this and missing out on wonderful experiences in school and with their friends. And we just need to keep those folks in mind, especially when we don't feel like distancing or wearing our masks, because if we are vigilant and remain so, our lives will get back to normal, especially those who have been most impacted. So I just encourage folks to stay vigilant and keep those folks in mind going forward. And especially going into the school year, we really need to remain patient because it's going to remain challenging. So let's stay vigilant. Thanks.
Thank you, Dr. Colli and Commissioner Keller, for joining me today and answering these important questions from our community. This video series is brought to you by Franklin Forward, a group of local stakeholders committed to turning the COVID-19 pandemic into an opportunity to reimagine Franklin County. To learn more and to watch other episodes, visit franklinforward.org. If you have any questions about how to safely navigate the ongoing crisis that you would like answered in future episodes, please use the survey link provided with this video. Until next time, remember, safety doesn't happen to you. You have to do your part. Thank you.